Minister of Health, Dr. Frank Anthony, says some $300 million will be utilized to purchase oxygen for COVID-19 patients at the Infectious Diseases Hospital, Lilliendale.
We have been paying approximately $1 per liter of oxygen. And right now, our patients, when they're in the ICU, some of them require about 15 liters per minute. So you can do the math and you'll see how much that is costing us. In some instances, we need to give patients as much as 30 liters per minute. So on a daily basis, we're spending a lot of money. And some of these patients in the ICU would be there for a minimum of 10 to 15 days. So it is costing the taxpayers of this country a lot of money when persons are in the ICU. Unfortunately, a lot of this could have been prevented if persons have been vaccinated, because we're seeing a lot of the unvaccinated persons who are getting sick and coming into the hospital. All of this could have been prevented if persons had received their vaccine. But apart from the oxygen that we have to deliver to these patients, the medication is also quite expensive. Remdesivir is quite an expensive drug. And all our patients at the hospital, once they're severely sick, they would be getting some of these things.
In addition to the oxygen, money will be used to boost the capacity of the National Reference Lab.
We are spending 1.3 on consumables for the National Reference Lab. And basically this is providing for the reagents and all the other pipettes and all the other things that are necessary for us to do PCR testing at the National Reference Lab. It looks like a lot of money, but consider that a PCR test is approximately $16,000 in the private sector. So this would allow us to do probably about 400,000 PCR tests. We also have another provision here for about $73 million that we are buying other laboratory supplies that we need to make sure that our labs are run very effectively. We have also, with some of the monies allocated yesterday, we'll be securing another 17 ventilators. These ventilators would be going out to the regions so that we can boost the capacity in the regions.
Monies will also be spent to procure personal protective equipment for health workers.
About 1.5 billion would be spent on acquiring PPEs. These are things like N95 masks, gowns, hair covers, shoe covers, things of that nature. Most of these things are disposable, so when healthcare workers use them, they dispose of them. So there's a high turnover of these items. So we'll be spending $1.5 million to make sure that the healthcare team is properly protected.
Here's an update on the country's vaccination campaign.
As of yesterday, we have completed 408,266 doses. These are first doses for our adult population. That's now about 79.6% of the adult population receiving a first dose. We have had 289,726 persons who have received second dose. That's about 56.5% of our adult population. In addition to that, in terms of the 12 to 17, we've had 29,964 persons. That's approximately 41% of that age cohort who would have received the first dose vaccine. And for second dose in that age cohort, it's 21,277 or 29.1%. Booster doses, we see a lot of people coming back to get boosters, and that's quite encouraging. So as of yesterday, we are now at 8,450 booster doses.
Minister Anthony stated that the administration of booster shots is positively progressing.
We are continuing to see that go up. In Region 1, for example, we now have about 41 persons who would have received their booster dose. Region 2, 144. Region 3, 1,122. Region 4, 4,711. Region 5, 457. Region 6, 1,459. Region 7, 90. Region 8, 31. Region 9, 333. And Region 10, 62. So the numbers are going up, and we want to continue to encourage people to get their booster doses, because with the looming threat of the Omicron variant, most of the scientists and the guidelines are saying that persons who become eligible for boosters should really go and get their boosters. So we want to encourage our local population to make sure that they go and get boosters.
That's it for today's COVID-19 update. For more information, visit health.gov.gy or dpi.gov.gy and our social media platforms.